Good evening, everybody, and thank you for joining us. We'll just wait a couple of minutes and see who's on. Okay, we are live. Just give a couple of minutes. There we go. There are a few people joining. Hi there. Thanks for joining us this evening. Okay, just wait for a few of you to join. How are you guys doing? Okay, here we go. Hi there, thanks for joining us. Let's Cherise and Mayo. And we'll just wait a few of you. Hope none of you are dealing with load shedding at the moment. Olivia, thanks for joining. Good evening, hope you're all well. It's just Queen Bee, thanks for joining. Okay, just wait a few minutes. So this evening we are talking to Carden, and Carden is from Lamelle, and we're going to be discussing PCOS and the effects it has on our skin. So if you're like me, dealing with PCOS, and obviously it obviously causes acne and stuff. So thanks guys, thanks for the love. We'll just wait a couple of minutes. Erika. Okay, I just got a message from Carden, so I don't know if she's live yet. Let's just, okay, there we go. I think Carden has joined us. So let me just, Carden, if you can, there we go. And Carden is there. Just send Carden a message. There we go. Carden. Okay. Hi, Carden.
Oh, shame. Sorry, my candle is now flickering and I don't have a can. Wait, let me see if I. Ooh, that looks really scary.
We'll just call it the candlelight filter. That's your candlelight filter.
My candlelight filter, okay. Let me not put it underneath my chin.
Okay, how are you getting connection?
My data, my data line's working well. Oh, I don't have fiber at the moment. Okay. I'll take my glasses off, then you don't see the reflection of the candle at least. It should come on soon. So
okay, great.
We had solar panel literally until 20 past, and then it all went off. So yeah. Anyway.
No, I'm actually somewhere else tonight. So I'm actually at a friend's place so that I can get proper connection. Because on my side, it just wasn't working at the moment. So thanks everyone for joining. We're seeing quite a few joining now. I think everyone's lights have started going on, so they're all connecting now. So that's great. Our topic this evening is acne and PCOS. And obviously, I did a story earlier showing my pimples. I'm just trying to keep it real because it really is an issue. And I'm like, I've got filters going, I got makeup on. So guys, you're not seeing my actual acne and how I really do suffer with. That's one of my things with PCOS, unfortunately, is the acne. So and Lamelle, it's great that we're talking to Lamelle because you guys have an amazing skincare range. So we really want to hear about your treatment, but not only the skincare treatment that you have, but also on the other side of it, nutrition and everything else that is involved when it comes to PCOS and the treatment of acne and all the the issues that comes with the symptoms of PCOS. So I'm going to hand it over to you guys. You almost don't need an introduction. You've had a few with us, and we really take you as someone that understands PCOS really well. So thank you again for joining us, and thank you for agreeing to do this and taking your time out to do this at this hour as well.
Thanks, Barbara. It's an absolute pleasure, Leanne. It's an absolute pleasure chatting to you. And I saw your comments. Sorry, today was a little hectic, but anyway. So I think where we really need to start is we need to start with what is actually causing the acne. And unfortunately, so yes, I know nutrition is really, really important. And I saw the comment on when I stopped my dairy and when I stopped my gluten that my bumps went away. But what if they don't? Okay, so there isn't a lot of data on diet because it's very difficult to put someone in an isolated environment and do a proper research trial and just, you know, you're definitely not taking in these things in your diet. So that makes it a little bit difficult. But what we do know about PCOS is when we go and look at the bloods of women who have polycystic ovarian syndrome, there are two things that are very, very prominent. The one is the fact that because you're not releasing eggs, you're also not producing estrogen, and that then causes an increase in your testosterone levels. Now, of course, that's managed by your pituitary gland. Your pituitary gland tells your adrenals, stop making testosterone. Now, I don't know if you're familiar with testosterone. Testosterone is a male hormone. It's the male hormone. But there are many conversions of the male hormone. But I'm not going to talk about that in detail. So you might be making slightly more male hormone, or you might be making a lot more male hormone. It depends on what your adrenals are doing at that stage. That's also one of the reasons why stress affects it, because of course when you're stressed, your adrenals are activated and you have more male hormone that's being produced. The second thing that happens that we know is you have a decrease in SHBG. What on earth is that? It's sexual hormone binding globulin. Now, I know that sounds really interesting, and maybe it should be something. Yeah, maybe we shouldn't be talking about it today, but okay. Now, what that is it's a protein. It's an amino acid. And it is in our bloodstreams. We have either free testosterone or we have bound testosterone. Now, in females, you need that binding of the testosterone to this SHBG, because otherwise the SHBG is nearly like the gatekeeper. It holds onto the testosterone and it takes it where it's needed. So it might get to a hair follicle and testosterone will go, can I go there? Can I please? Or the sebaceous gland, can I go there? Can I please activate that sebaceous gland? And SHBG goes, no, we don't need more oil in the skin. But when it gets to, I don't know, when it gets to muscle, you might be building muscle, it will release the testosterone so that the testosterone can link to the muscle and it can grow the muscle. So that SHBG is a very important component to keeping testosterone in control so that it doesn't link to all the male hormone receptors. Now, in PCOS, our SHBG is lacking. It's lowered. We know that. We can see that in in females' bloods. And so we have not only more testosterone, but we have a lot of free testosterone floating around. That free testosterone goes to the sebaceous gland and it links onto the sebaceous gland, and the sebaceous gland goes, yay, let's make sebum. All right? What it also does is it changes how the cells shed and how they are produced. They produce really quickly, and when they get to the top of the skin, they don't shed very well. So we have two things that are driven by this. The one is the oiliness, and the other one is more comedoes, more blockages, more congestion. And of course, that then becomes a recipe for disaster, because add to that a little bit of bacteria, add to that a slight bit of inflammation, and you've got full-blown acne. And that's one of the reasons why in many cases, just taking a skin product and putting it onto your skin, you'll find that some women will say, I'm so tired of this. I'm so tired of trying to manage this. I don't know if you experienced that, Leanne, is that you just go, you know what, doesn't matter what I do, my skin always breaks out. I don't even have a cycle, but my skin's always breaking out. Why is this happening? And it is because of the free testosterone and the SHBG. So what Ovaria does is, we know that the ingredients in Ovaria, so the myo-inositol specifically, goes and it of course fixes what's happening with the follicle. The follicle now releases an egg. We manage the testosterone. We also know that with myo-inositol we have increased SHBG being produced. So we're managing the bloodstream levels of testosterone, even though we're not actively going. We don't, as a company, as a supplement, sorry, that was very Afrikaans. As a supplement, we can't change your hormones. We shouldn't be doing that. Okay. But we're using a natural product to control the excess hormone. So in the first place, that really helps. We've got data that supports that. We've got, in fact, in one of the trials over, I think it was 16 weeks, we had 30% of women had a full clearance of their acne, just with the ingredients in Ovaria. Wow. At Lamelle, of course, as you said, we're very advantaged because now we've got a skin product on top of that as well. So we've got our Clarity range, which is a topical product. And then we've got Acneval that's got vitamin B3 and zinc in it. And now we've added a little bit of copper because you get copper deficiency if you use zinc for too long. And we can combine that with ovarian PCOS so that we can improve the results. Now, because we haven't trialed them all together in a clinical trial, we haven't done a controlled trial, I can't give you numbers on the improvement, but I know of many females who were, my daughter's one of them, she's always been using Clarity and Acneval, and now she's added Ovaria, and that just seems to push it over the top. So wow. She's seeing much more improvement. So she saw good improvement with the Clarity and the Acneval. Didn't go away completely because she's got PCOS. Add the Ovaria and we're improving the results. So we're actually now in a phase where we are now treating scarring because the acne is very much controlled.
Yeah.
Questions?
Yes, I've actually got one. You can actually see the question on my face, I think. You can actually see it. So I really want to know, like, I always thought, once you hit a certain age, I don't want to say the symptoms of PCOS, does it decrease? The acne and stuff, because I'm thinking, at my age, I'm not old, but I'm 40. I just turned 40. Yes. And I'm thinking, do you know?
You lie.
No, I'm serious.
You don't look.
Thank you. But I'm thinking, shouldn't I already see a difference with my skin and my hormones and everything else with PCOS?
There is a theory that the problem is so you've had a challenge with your ovaries not producing, not doing what they need to do. And then unfortunately, as we age, we also then go into menopause. And in menopause, we no longer have the eggs that are being produced, and we also have hormone. We also have more male hormones. So unfortunately, you're going from one phase to the next. Many females do see improvements in their acne, but you will have to go into menopause first before you can really gauge that. But then on the other side, you might in perimenopause have a little bit of worsening of acne. Once you're through perimenopause is a phase where you still have the odd egg releasing, or you still have, they talk about anovulatory menstruation, so where you're still menstruating. If you've stopped menstruating for 12 months, but it's difficult because in PCOS, we don't know, you don't know, aren't you, where are you? So I would suggest go to your gynae. They can, with just a sonar, they can see if you've still got ovaries that are active, and they'll be able to tell you where you are in your growth phase. I want to call it, because it is just another phase that you're moving into. So it's really going to depend on what's happening with your ovaries, and how you go into the next phase. So it is about constant management, which is actually quite traumatic. That's not fair. I realize that.
Not for it at all. And the strange thing is, with my last fertility treatment, we obviously did the test to see if I've got eggs, and the doctor was actually quite surprised to see that I've actually got quite a lot for my age. And she was like, she really thought she's going to struggle when there was quite a lot. It's just obviously nothing happens.
Well,
But I mean,
you might
that's
be
everything else works
yeah.
perfect. It's just I've just got the acne stuff.
It's fantastic, but it
Yeah.
does mean that you probably could be potentially fertile
Mm.
into your 50s. So I know that everybody thinks that they need to, I'm going to stop ovulating, I'm going to stop having babies in my 40s.
Yeah.
All of us have that friend who has a mother who had a baby when they were 53 or 54. It can still happen. So
Yeah.
if you still have quite a few eggs that are potentials to ovulate, you're still
Yeah.
producing estrogen.
Yeah.
You've still got that fluctuation of hormones happening every month. So that could still, so it is about looking at what kind of acne you have.
Mm.
I always suggest go to a skincare specialist that's trained. Let her walk a path with you, because acne isn't just have one pill, quickly slap a product on. You know that. Slap a
Yeah.
product
Yeah.
on, or get a script from the doctor, drink 3 tablets, and tomorrow morning I wake up with perfect skin. That's not the truth. That's
Yeah.
unrealistic. It is a long-term management and constant management. And we, at Lamelle, we have to remind people that if you are acne prone, you are acne prone. Your body thinks it's sexy. When I talk to the teenagers, I go, your body thinks it's sexy to have acne. I know that it isn't, and I realize that. But your equilibrium is unfortunately different, and it's due to the hormone levels. And
Yeah.
try and get into a place where we are controlling hormone levels better. We definitely need to look at our nutrition. So I know that I don't know why when you stop drinking milk and when you stop eating gluten that your acne goes away. It might just be that, once again, your skin responds with an allergic type of reaction
Yeah.
to those ingredients. So it might be that it is related to the inflammation that those ingredients are creating in your body.
Yeah.
And we know that acne is a very inflammatory disease. It's triggered by inflammation as well, apart from the hormones. So that might be why diet is so important, or specifically dairy and gluten are so important.
Mm.
But just for a good skin, you need to look at having enough and taking enough antioxidants, drinking enough water,
Mm.
having a routine of cleansing and moisturizing, because that's another thing that we think. We think we got pimples, now we've got oily skin, so we shouldn't put a moisturizer on. That is a
Mm.
total fallacy. You
Yeah.
constantly losing oils, and if you're losing oils, you're not trapping water well, the enzymes don't work, and you get pimples.
Yeah.
So
Yeah. Yeah.
the
You
basics that I
touched.
would recommend.
Yeah, you touched on something that I was actually going to ask you about is nutrition. And we tend to forget that, yes, we can take the Varia, we can take the supplements, we can use the skincare range, but again, it's also nutrition. The other thing also is everyone's body responds different. Everyone's body is different. So me not drinking milk or something might be different for you. You can drink the milk or the
Mm,
dairy, say the dairy, and it won't affect you at all. But when I do it, it affects me. Am I right in saying that PCOS is
definitely.
very different for everyone? So we
Yeah.
can't say, exactly that. Is that what you're saying
Yeah.
about it as well?
Oh, definitely. So, and also how you experience your symptoms will be different.
Yeah.
So some girls might just have oily skin. Other girls have oily skin, hair loss, weight loss, hormone fluctuations, and multiples of those symptoms. And I think
Yeah.
that's one of the things that makes it difficult to diagnose, because there isn't a strict, it's an ABC. And I have to giggle. I've been in the medical industry for many, many years. And I find it so interesting that people think it is an exact science. There's nothing exact about it.
Yeah.
We, humans vary so much. And that's also why I like you to work with a skincare therapist if we are looking at the acne management, for instance, because she needs to walk the path with you, and she needs to see what's going to work best for your skin.
Yes.
And it might not be what's best for your neighbor's skin. Um, So it is about looking at, and you have to start walking through a cause and effect kind of pathway. So you have to say, okay, and when you cut out dairy, for instance, you have to cut it out for a good 14 to 21 days, maybe even a month. And that means that you can't even eat butter. Nothing. No dairy. Nothing, nothing. Okay. Sometimes we don't think, you go into a restaurant and someone puts butter on your veggies.
Yeah.
You've had dairy, so you have to cut it out completely. You have to live nearly an inconvenient life. And then you have to see, has anything changed in my body? And it has to be not only your skin, but how do you feel? Do you find that your sinus has improved? Stupid little things like that. And then you might want to bring it back and see what happens with your body when you bring it back. So, it's difficult deciding that you need to make these changes and adjust your lifestyle according to that. But in the end, it is about what is your motivation. Yeah. Am I doing things to keep myself and my body healthy? And if you follow me on my personal page, you'll see that I'm in that process of going, you know what? I cannot live the way I've lived.
That was going to be at the end of it, I was going to say to you, like, you are looking absolutely great. I see you've got a new haircut and some new color. You look amazing. I saw your posts, so you look absolutely amazing, and I'm so glad you're doing something. I wish I had the courage. Some days I try and then I get back off. We're human, it happens, but we try. But kudos to you for doing that.
I so understand that. I am so lucky that this is another thing that I did. So I know that this doesn't necessarily link to our conversation now, but I am a serial dieter. If there's a diet out there, I've been on it. I have also always been overweight. I mean, I think I believe that we were joking the other day about they were in my life. I think there were 6 or 7 weeks where I could see the bone on my chest, but it was just those 6 weeks. That's I've never been thin. And it is always, I buy into this program and I run with it. And the first thing that happens, the first place that I falter, it's like, giving up, this doesn't work. And I've actually bought into the dietitian route, and I have a phenomenal little dietitian. She's beautiful, she's minute, and she doesn't give me a hard time. She just goes, really? That's not good. Maybe you should do this, this, and this, and this. And she doesn't let me get away with anything. So it's been 12 weeks. Yeah, it's been 12 weeks. I'm now at any other diet, I would have long gone. I would have been offered and have picked up the weight again. But I've just decided now I need to do this. I need to do this now. I need to get my body. I don't want to be a round grandmother. And I don't want to be overweight and 60. And the thing is that my big scare was my BMI. Now I know BMI isn't the best challenge or the best measure of health, but I had to go to a cardiologist. I had to have a cardiac screening, and the cardiologist said, you're healthy at the moment, you're fine, your heart's good, everything's okay, but at your BMI, if your BMI stays high for the next 10 years or the next 5 years, there's a good chance that in 10 years' time, I'm going to see you in the cardiac unit. And I was like, I've worked in cardiac units. Nobody's opening my chest up ever.
Yeah.
So,
wow.
Then it's sort of, okay. It becomes real. It becomes not just my knees hurt and I'm not just uncomfortable, but I really need to look after myself if I want to live to 100, which is hopefully where I'll get.
Yeah.
Anyway, but let me just now.
So I don't know if we just want to recap and just go through what we mentioned when it comes to treatment of the skin. It's obviously supplements, water intake. It's very important. I think that gets drilled into us so many times, and And some people are good with that, but I'm terrible with the water. Um, and obviously, just check what works for you. Work with a skincare, what's it called, a dermatologist or something.
Professional, a skincare therapist.
Yes,
Yeah.
yes, yes. And then also just to mention that the Ovaria product is available. It's on our store, and you can also go directly to the Lamelle site where they also have the skincare range, the great Clarity range. Am I right? Clarity?
Yes,
Um,
Clarity, yes. And then the
Clarity. So
Acne as well.
Acne. So, guys, if you are struggling with it and like me, please go and have a look at that stuff and just read up about it, whatever. And I know you on the mail site, you can also contact you guys, and there is someone that actually chats to you and gives you some advice. So that is absolutely great. Yeah, I don't know if you have anything to say before we go.
Any questions? Yeah, just would like to reiterate that. Are there any questions on our
Mm,
chat this evening? I can't actually see.
No, I don't.
Um,
I don't see anything right
but
now, but like I
don't
say,
see
I always
anything.
say, as soon as I'm done with it, I saw something come through, but it's in my inbox. So
Okay,
some people just like to send you private messages and they don't want to just do it in the group. So that's great.
I
And
understand that
obviously, I always send
completely.
it to you guys and stuff. But again, like I said, if you
Yeah.
guys have any questions, you can also go to the Lamal site and actually chat with somebody there that will give you the
Yeah.
correct advice and stuff with regarding their supplements. Um,
So
again, I
if
just
you
want
go yeah, if you go on the very site, you're actually talking to me. So I get those in my inbox. If you are wanting to find out more about therapists in your area, please ask on that group, and what we'll do is we'll find someone that specifically looks after acne, and we can send you their details then. So it is about geographical area. We've got salons all over South Africa that stock our products. So chat to us. If you've got any questions, please don't hesitate to ask. We're very happy to educate and to train. So
to.
thank you very much for the
It's a
opportunity.
pleasure.
And
I just want to mention one other thing that the countries that you do have, because I'm always getting messages from Namibia. I think Botswana is another one. I don't know what other countries, Nigeria, of course. Nigeria, Botswana, Namibia. In what countries exactly are you now stocking it? I know Namibia is definitely the one of
okay,
them.
Namibia, we've got a distributor in Botswana, so we can get product to you there. Mozambique, we've actually partnered with a very big spa in Mozambique. Zim, we've got a few salons that stock
Okay.
Lamelle. Zim's doing very, very well. Mauritius, Ghana,
Oh,
Nigeria is opening soon. So we're
wow.
working via Ghana
Awesome.
into Nigeria. So, and then
Okay.
interesting little countries like Benin, and we've got someone not in Dubai, but yes. But ask if you are in those countries,
Wow.
we can see if we
Yeah.
can talk to you, and
And,
we'll refer you to someone.
yeah, and just the last thing is that Ovari. Remember, Ovari is a product that is it helps you also when it comes to trying to conceive. So it's a great product all round for quite a lot of things. Definitely go and read up about Ovari. It's on our site. I post constantly about it, and I do some videos on it as well. So have a look there. But thank
Thank
you,
you.
Karen, for joining us. It's been a pleasure as always. Always great talking to you, and I end up with a nice big smile on my face at the end of it. So thank you so much, and hope to chat to you soon.
Thank you, Leanne. Have a phenomenal evening. I wonder when our lights are going to come on again. But anyway,
Okay,
candlelight
all the best.
version.
Thanks. All the best, God, and see you. Bye.
Thank you. Bye.
Bye.